my commitment to healthcare. You know, I grew up watching my father for 6 years in a poor neighborhood, every day, going to work, providing care to his patients, many of whom who could not afford it. And for my 16 years in Annapolis, I've been committed to ensuring that no Marylander has to rely on the generosity of a health provider like my father or all the countless Marylanders who are providing uncompensated care, or to have to rely on the availability of an emergency department. The only one that was cheering on failure for Obamacare were the Republicans, joined by Attorney General Gansler. He was on the sidelines. He was a member of the Health Reform Coordinating Council, didn't attend a single meeting, and when asked publicly, did you have any responsibility? He said none. He said that he had no idea about how we settled on the contractors we did, but his office helped scope out the procurement that led to the vendors that were selected. Look, we all had a responsibility. I didn't run away. I said, yep, everyone that helped establish the exchange had a responsibility, and that includes me. And we stuck to it. We rolled up our sleeves, a lot of manual workarounds, and today, 340,000 Marylanders, real Marylanders, not a big number, right? It's not just the number, it's the people who now have access to affordable, quality health care.
So, I wasn't on the sidelines anything. I'm the Attorney General of Maryland. I was not in charge of the healthcare website, nor did I ever say I was. I didn't run around for 3 years telling people I was, and then lie to the people of Maryland when I knew it wasn't going to work, and not tell them it was going to work. Yes, I have no idea how the vendors were picked, because it was done in a closed room without any competition and without any transparency. So they picked a company from literally Fargo, North Dakota, via the Ukraine to run this thing. Then they did it again, chasing like the definition of insanity. They went back in the closed room and decided to take Deloitte from Connecticut. Even the people from Connecticut say it won't work. Instead of going to the federal system, our President Obama's system that actually does work and was signing up people at 50,000 people a day. I don't know what a manual workaround or whatever the gibberish that keeps being said as an excuse for the failure of the healthcare even means. But I can tell you, I wasn't out there shaking down healthcare companies to almost $1 billion of healthcare money instead of doing my job. That's the difference.